All right. Hey, everybody. It is Tuesday, the 29th of April. So we are here for Measles 101. I'm Kirsten Short with the Houston Health Department, and we will give just a moment for our folks to join on. All right. Well, we're getting everybody to join on. If you don't know me, if you haven't seen me before, I'm Kirsten Short. I'm the Chief of Epidemiology here at the Houston Health Department. For those who don't know epidemiology, we're kind of the sort of disease detectives of the health department. So we are the ones that get information when there's something of concern and talk to the healthcare providers, talk to folks in the general public, about what's going on and see what ways the health department can work with everybody to stop the spread of illnesses, basically. So talking about Measles 101 today, I wanted to give a couple quick updates. So the state just updated their cases for the outbreak over on West Texas, right? So that those outbreak numbers today have gone up to 663 cases since January. And that includes 87 people that were hospitalized, and we know that we had the 2 school-age children who died. They've added a new piece of information in the last couple weeks that to their updates, and so they're saying this has been an increase of 17 cases since they did their last update. So last update was last Friday. So between Friday and today, they've added 17 new cases to the case count. What they're also saying, though, is that they're estimating that fewer than 10 cases are actively in that infectious period. And remember, we talk about that almost every time we're on here, right? That infectious period is about 4 days before rash. You've got that day of rash and then 4 days after rash. So they're saying that probably only less than 10 of those cases are within that infectious period. That's actually one of the things that can make getting a hold of a measles outbreak pretty challenging, right? Is because, again, you're infectious before you've got that rash, so you might not realize that you've got measles or that concern. And then you got to go to the doctor, then you've got to get the test, and then the test's got to go to the lab, and the lab has to be run, and then it's got to get back to the doctor, and then it's got to get back to public health, right? So we're playing a little bit of catch up in here. And that's why what I really want to talk about today is why sort of those public health interviews are really so important. So we talked about this maybe a month or two ago about what happens when public health calls you. And so I just wanted to talk about that again a little bit, right? So when we have a provider who thinks, maybe I need to test one of my patients, one of my clients for measles, and then measles is a notifiable condition in Texas. So they actually are required by statute to call us or public health, right? And let us know that that's going on. What we do then is often reach out to that person depending on sort of what we think is the likelihood of illness, right? And so if we reach out to you either because there's a suspicion that you may have measles or that we've got that positive test back and it's been confirmed, we're going to ask a lot of questions. And why do we ask these questions, right? So we're going to ask about symptoms. So first of all, we want to kind of confirm what that illness was, make sure that it really is compatible with measles, particularly if we don't have the test result back yet. But the other important thing about symptoms is because we're really trying to narrow down when that infectious period was. So if you're the measles patient, right, when you were infectious. So that's why we'll be asking a lot of questions about symptoms. We're also going to be asking questions about vaccine status, right? And so we know the measles vaccine is a really good vaccine as far as vaccines go in terms of preventing illness, but we know that no vaccine is 100% effective. And so we do sometimes see cases in people who don't have 2 doses of vaccine. We also see cases in people who only have 1 dose of vaccine. And so we want to find out about that as well. The other thing we're going to do, right, is ask about travel history. So we want to know sort of what has happened in the time before you got ill. So where did you go where you might have encountered someone who might have exposed you to measles then, right? So we're trying to create that chain. And then we're also going to be asking, where did you go when you were in your infectious window? So before you started isolating and staying home on that side. And so, right, there's two pieces that we're looking at. One is maybe how did you get exposed to measles, right? And then the second is how or where might you have exposed other people to measles? And we're looking at a couple things that we're particularly concerned about. So the first being high risk settings, right? So that would be settings where there's a higher risk of exposure, and that might be because we're running into people who are either at increased risk of complications or who are more likely to develop disease. So that might be, daycares or summer camps. We're also looking at doctor's offices, medical facilities, things like that. And then the other thing that we're really trying to look at are people that are at higher risk again. So those are locations, but also people who may be at higher risk of developing complications or getting diseases. Manuel, I see your question. I'm going to get to that in just a second, I promise. So people who are at higher risk of developing complications from the illness would include pregnant women. So a woman who is exposed to a measles while she's pregnant and she's not immune, right? She has an increased risk of premature birth, so giving birth to that baby early and that baby having a lower birth rate or birth weight, excuse me. And so those are sort of adverse outcomes. And then we're also looking at babies that are too young to be vaccinated who might have been exposed, right? Remember, the measles vaccine generally is offered to babies at 12 months of age, the first dose at 12 to 15 months, but it can be given if you talk to your pediatrician as early as 6 months of age. But if a baby is below 6 months of age, it's not, they're too young to get the vaccine. And then we're also looking at, folks who are undergoing chemotherapy or doing something where their immune system is not fully robust or intact. And so we're really looking at those folks because we want to make sure we get in touch with those folks as quickly as possible. Now, we talked about dosing. I see a couple questions in here. So a couple questions. We talked about on the childhood vaccine schedule, right? So it's normally recommended first dose is going to be at 12 to 15 months of age for a baby. And then normally you don't get your second dose until about your 4-year visit. However, that is okay to give a second dose early. And so you can actually get your second dose as early as 28 days after the first dose. So you need to wait at least 4 weeks, 28 days between those two doses. So the schedule is usually you give it to those babies at that first year, and then they usually give that second dose around 4 years, which is right when kids are generally going to go to school and all be clustering together. And if you've ever been the parent or a teacher of a school-age child, you know that they like to spread stuff between them just because they're young, right? But you can actually get that second dose as long as it's been at least 28 days after that. And for babies that are too young to be vaccinated, so there's a couple things here, right? I said, normally we would give it at 1 year of age or 12 months. You can give it as early as 6 months of age. So again, if you're thinking about traveling with your family, or you've got some other concerns, that's definitely something you can talk to your doctor. It is okay to give it early. It does mean, though, that they're going to end up needing to get a second dose again at 12 months of age. For those babies who are less than 6 months of age, there will be some level of immunity that they'll have from their moms if their mothers were vaccinated prior to getting pregnant. Because remember, we can't give this vaccine to women while they're pregnant. So if you have some immunity yourself, that a little bit of that will pass on to babies. For your babies that are too young, if you're worried about them, it is okay to think about what you're going to do. We don't have a lot of folks walking around with measles in our community here in Houston, right? We don't. We have a lot of concerns about it, but we don't right now. And so, going out and about in your life is probably going to be okay. Where you want to think about it, you might choose not to go to large gatherings where you might not know. You might want to ask your friends and people who are coming over Have they been vaccinated? If that's a conversation you're comfortable having with them. And you may not want to go, for instance, to overseas travel or to areas where measles is actively circulating. And if you go onto the CDC's website, there's a little bit of information on the state of Texas's website about the West Texas outbreak. And if you go onto the CDC's website, they have a measles outbreak page. And it does talk about where there are different measles cases being reported in the United States and where there may be circulation going on. And so again, for those babies who are under 6 months of age, and when you're worried about them, you don't need to keep them home because, like I said, we're not in an area where we have a lot of measles actively circulating. But you do probably want to think about whether or not you want to go to sort of really large gatherings on that side where they would be exposed to a lot of people. But if you're just going to the grocery store, sort of those things, you're fine. And we have come up on the end of our time. So thank you, everybody, for joining in with us. We will see you again on Thursday. So talk to you later. Bye-bye.